We have a healthcare system that is not functional. It's functional as a healthcare system, but it's not functional for the community they serve.
I live in the sickest and the poorest region of Kansas. People die 10 to 15 years younger here. And the problem is there's no access to care or limited access to care.
Is it right that if you live in Wichita, Kansas, and you have a rheumatologic problem, you will be seen? Nobody will question that. But if you live in a rural area and your rheumatoid arthritis is so bad that you can't drive anymore, you die. Is that right? Should your zip code determine what kind of care you receive?
Access to care is a huge issue, and it's one that, if you're not dealing with this on a day-to-day basis, can almost be too ethereal or lofty to really understand. It's extremely hard to tell someone that because he doesn't have insurance, he isn't eligible for further care. That lack of insurance is costing him his life.
Our desire is to help people who cannot help themselves and create an environment within our community to where they can find resources that they can then help themselves.
Part of what we do is look for ways to get them increased access to care, and it might mean telehealth.
At its simplest, telemedicine is just the use of the internet to have a video chat to connect a healthcare provider on one side to a patient that needs care on the other side.
If our purpose here isn't to help meet needs, then we're in the wrong place. We want to provide access to care where access to care is not necessarily affordable or achievable on a short-term basis.
From our perspective, it's a pretty easy moral decision. Let's talk about how we do this in a constructive way that's sustainable for all.